Have you ever woken up in the middle of the night, your legs cramped in pain to the point where you couldn't go back to sleep? Do you feel helpless and confused because these pains are becoming more frequent, gradually making you dread the night? Hello, I'm Dr. Victor Liu, a geriatric specialist with over 25 years of experience caring for individuals over 60. Today, I want to share a concerning truth. The leg cramps you've been enduring every night are not just a normal sign of aging. They may be a warning for more serious health issues that you might not have considered. What happens if you ignore these seemingly minor signs? Over time, the pain will gradually destroy the quality of your sleep, leading to persistent fatigue, memory loss, and lack of focus. You might face a higher risk of falling, losing your ability to move independently, and even becoming reliant on others for the simplest tasks. This is certainly a scenario none of us want to face as we age past 60. But don't panic. In today's video, I'll explain the exact causes of leg cramps in older adults, ranging from the simplest reasons to the more serious health concerns that you need to be aware of right now. Stay calm, sit back comfortably, and keep your eyes on the screen. The knowledge I'm about to share will definitely help you understand your situation and take back control of your life, so you can live healthily, happily, and enjoy your senior years to the fullest. Ready? Sit down, have a cup of tea, and let's get started now. If you find this information helpful, please give me a like and follow the channel so I can share more with you. 1. Electrolyte deficiency. You may not know, but our body operates in a much more intricate and complex way than we imagine. One of the key factors that help muscles function properly are electrolytes such as calcium, potassium, sodium, and magnesium. When your body is deficient in these substances, cramps will appear as a warning bell from your body. For older adults, maintaining electrolyte balance becomes more challenging due to a decline in nutrient absorption. An inadequate diet, low water intake, or the use of diuretics can all lead to deficiencies. Especially, those who frequently take blood pressure medications, heart medications, or diabetes medication may face a much higher risk of electrolyte imbalance than the average person. Imagine this. Each time you sweat, or simply take a diuretic without replenishing the necessary electrolytes, your body will struggle to function in a state of deprivation. It's like your motorcycle trying to run without oil. Over time, the machinery will be damaged and stop working. For your muscles, this manifests most clearly through painful cramps in the middle of the night. So how do we fix this? First, thoroughly check your diet. Do you often eat potassium-rich foods like bananas, oranges, or sweet potatoes? Have you provided enough calcium through milk or dairy products? Drinking enough water and supplementing magnesium through nuts like almonds, cashews, or leafy greens is also extremely important. Start with the smallest steps to ensure your body never lacks these vital electrolytes. Don't let cramps ruin the restful sleep and happy life you deserve. 2. Poor blood circulation. Have you ever thought of your legs like a river that's been blocked and can't flow easily? That's right. Poor blood circulation is one of the most common causes of painful cramps in older adults. As we pass the age of 60, our vascular system weakens, and the ability of blood to circulate to our muscles becomes more difficult. This causes muscles to lack oxygen and nutrients, leading to sudden cramps, or what you may recognize as those painful leg cramps. You can imagine blood flow as water flowing in a river. If the river is blocked by branches or mud, the water will flow slower or even stop completely, causing various issues. Similarly, when blood can't circulate well, muscles don't receive enough oxygen, leading to fatigue, pain, and cramps. Several factors that increase the risk of poor circulation include diabetes, high blood pressure, atherosclerosis, and even the habit of sitting still for long periods or being inactive. Sitting still for too long not only negatively affects blood circulation, but also weakens muscles, making cramps more likely. Think back to the last time you stood up after sitting for a long period. Did you feel that your legs were stiff and painful? That's the sign that circulation is being affected. To improve this, you need to develop a daily habit of light exercise such as walking, yoga, or simple at-home exercises. Just 15 to 20 minutes of movement each day can significantly improve blood circulation, reduce the risk of cramps, and help you live a healthier, more energetic life. Thu hut chat dien jai. Ko the ban kong beat. In hung ko the chung ta van han mot catch ky ju va fuk tap. Han nu so voi chung ta tuong tuong. Mo trong and hung yu de quan trong jup ko bap, hot dong bin thuong, chin la chat dien jai nut sanchi, kali, natri, va meiji. Kai ko the ban thu hut and hung chat nai. Con chut rut esi, zut hien nu mot tieng chuang, kan bao tu ko the. Voi nuoi chow tuoi. Vik duwei tri kan bang chat dien jai tiaro nin ko con han, du kan nong hap Thursday, chat din duong sui jayam. Che duan wong kong day du, wong at nuok, hok su dung mot, so lo I thwak loi tu du ko the dan din, su thu hut nai. Dac beat, and hung nu doi thuong shuyen wong thwak hu yet ap. Thwak tim mak hok thwak tri bin tu duong ko the doi mat voi noi ko mat, kan bang dien jai, chow han yulan, so voi nuoi bin thuong. Ban hei tuong the nai, ma lan ban vamo hoi. Hok don john shi la ban wong thwak loi chu ma kong bo sung, lai du luong chat dien jai kan thiet. Ko the se fi ko gang hot dong trong trang tai thu thon. Du nai jong nu vik cheek xe mai qua ban ko gang che ma thu not. Lao dan. Mai mak se by tun thuong vine gung hot dong. Doi voi ko bap qua ban. Tin trang nai bu hien aro rong not qua and hung con chut, rut dao don veo jua dem. Ve lam the now de kok fuk, tin trang nai. Truok het. Hei kim tra ky luong che du din duong qua ban. Ban ko thuong shuyen and hung tuk fam jiao kali nu chui, cam, koi lang kong. Ban de kung cap, du sanchi qua sua. Kaksen fam tu sua he chua. Vik wong du nuok va bo sung meiji thong qua kak loi hat nu han nan, hat du. Hok rao las and kung cuc ky quan trong. Hei bat dao tu and hung byuk no not de dam bao ko the ban kong bao geo, few hut, and hung chat dien jai, quan trong nai. Dungda and hung con chut rut fa hong jiak ngu va kuok song vui vi ma ban sung dang duok hong. Tuan hon mao kim. Ban ko bao geo gi rang doi chan qua ban nu mot dong song dang by takingen. Kong the lu thong de dong. Dung vei, tuan hon mao kim chin la mot trong and hung gwen, nin phobian gare, con chut rut dao don cho nuoi chow tuoi. Kai byuk qua tuoi 60, he thong mak mao qua chung ta dan sui yu. Kan on tuan hon mao din kak ko bap, tro nin ko kan han. Junai keen kak ko by thu oxy vadin duong. Dan toi hien tuong ko kung bat ngio. Hei chin la and hung kan chut rut ma ban dang fi chiu dong. Ban ko the hin dong. Mao lu thong jong nu nuok che trong mot kan song. Nu dong song by chan boi kan ke hok bun dat. Nuok se che cham lai hok and gung hon tone. Gara nu van de kok now. Tuong tu. Kai Mao Kong the Lu Thong Tot, Ko Bap Se Kong and Duok Du Luong Oxy Can Thiet, Gara Tin Trang Met Moi, Down Huk Va Chut Rut. Motso Yu de Lam Tang Noi Ko Tuan Hon Mao Kim Bao Gom Ben Tu Duong, Chow Huyet AP, Exo Void Dong Mok, Va Tam Chi La Thoi Quin Goi Lao Mot, Cho Hokat Van Dong. Viken Goi Yin Mot Cho Trong Thoi John Dai Kong Chi on Hung Za Den, Tuan Hon Mao Ma Kon Keen Kak Ko Bap by Sui Yu. De dan toi chut rut. Ban hei no lai lon gon not ban dung len di lai sao kine goi lao. Ko fi ban cam thay chan min rat kung va dao kong. Du chin la dao hu tuan hon mao dang by on hong. De kai tien tin trang nai. Ban kan tao thoi quin van dong nain hang hong gay nu di bo. Tap yoga. Hok tu kien kak by tap don john tai na. Chi kan 15 to 20 foot van dong moi gay kung. Du de kai tien dang. Ko tin trang tuan hon mao. Jiam Thu Noi Ko, Chut Rut Va Jup Ban Ko Mot Kuok Song Ko Man, Tran De Nong Luong. 4. Vitamin and mineral deficiencies. If you ever thought that cramps were just a simple muscle issue, let me share a real story from my clinic. A 68-year-old male patient came to see me looking exhausted because he was constantly awakened by severe leg cramps every night. He thought it was due to overexertion, but when I asked about his diet, he admitted that he rarely ate vegetables, didn't like drinking milk, and almost never used supplements. After a series of tests, the results weren't surprising. He was severely deficient in vitamin D, B12, and magnesium. This leads me to an important point that many older adults overlook. Vitamin and mineral deficiencies are the silent culprits causing chronic leg cramps. The role of each vitamin and mineral. Vitamin D helps the body absorb calcium, which is essential for muscle contraction and relaxation. A deficiency in vitamin D lowers calcium levels in the blood, making muscles more prone to cramping. Vitamin B12, not only related to blood, B12 plays a crucial role in maintaining nerve function. A lack of B12 causes the nerves that transmit signals to malfunction, leading to muscle miscommunications, cramps, and numbness. Magnesium. This mineral regulates nerve and muscle activity. Low magnesium levels can interrupt the electrical signals that control muscle function, resulting in abnormal cramping. Potassium and calcium. A potassium deficiency disrupts muscle function, making them more susceptible to involuntary spasms. Calcium, on the other hand, affects the ability of muscles to relax after contraction. Without enough, muscles can become stuck in a contracted state. Why are older adults more prone to deficiencies? After the age of 60, the ability to absorb nutrients from food declines. The digestive system works less efficiently, and lower stomach acid levels make it difficult to absorb B12 and magnesium. Additionally, if you're taking antacids, metformin, or diuretics, they can further deplete essential vitamins and minerals. Some individuals also follow poor diets, eat unbalanced meals, or are afraid of eating fatty foods, which can lead to significant deficiencies without realizing it. Particularly in Vietnam, vitamin D deficiency is common, as older adults often stay indoors and have limited sun exposure. Signs of deficiency: frequent cramps, especially at night, numbness or tingling in the hands and feet, fatigue, insomnia, irritability, brittle nails, hair loss, mild muscle tremors, especially during stress. If you have 2 or more of these symptoms, consider reviewing your nutrition or getting a blood test to assess any deficiencies. Safe and effective solutions. Boost your nutrition with natural foods. Eat more dark leafy greens, spinach, kale, fruits, bananas, avocados, oranges. Include dairy, eggs, salmon, and tofu for calcium, vitamin D, and B12. Nuts like almonds, walnuts, and chia seeds are rich in magnesium and omega-3s. Sunbathe in the morning, before 9 a.m., for 15 to 20 minutes daily to help your body naturally produce vitamin D. Use supplements, if necessary, under the guidance of a doctor. This is especially important if you're a vegetarian, have malabsorption issues, or have chronic conditions. Regular checkups. People over 60 should check their vitamin D, B12, and magnesium levels every 6 to 12 months to make timely adjustments. My honest advice: I've witnessed many patients who, by simply adjusting their diet and supplementing the right nutrients, significantly improve their cramps, sleep quality, and mental clarity. Don't underestimate the importance of small micronutrients. They make a big difference in the quality of your senior years. 5. The use of specific medications. Did you know that the very medications you take daily to manage chronic conditions could be the hidden culprit behind those persistent leg cramps in the middle of the night? It might sound strange, but this is one of the most common and often overlooked causes in people over 60 that I've encountered throughout my medical practice. I remember a couple in their 70s, both of whom followed their doctor's prescriptions very strictly. However, every night, they were woken up by severe leg cramps that kept them from sleeping. When I reviewed their medication lists, I immediately noticed the issue. Both were using strong diuretics and statins, medications that are known to cause electrolyte imbalances and muscle issues. Why do medications cause cramps? When medications enter the body, they don't just target the main problem they are intended to treat. They can also affect other biological processes. In relation to muscles, medications can have the following impacts: electrolyte imbalance, especially sodium, potassium, and magnesium, due to increased excretion through urine or interference with absorption. Muscle toxicity or a reduction in the enzymes needed for effective muscle function. Mild damage to peripheral nerves, causing muscle contraction and relaxation signals to become inaccurate. All these factors make muscles more sensitive and prone to uncontrollable cramping. Medications commonly causing cramps in older adults. Diuretics, often used to treat high blood pressure and heart failure. These medications dehydrate the body and deplete potassium, two crucial elements for muscle activity. Statins, used to lower cholesterol. Statins can cause muscle pain, weakness, and cramps in some sensitive individuals. Blood sugar-lowering medications, insulin or sulfonylureas. These can cause sudden drops in blood sugar, affecting the nervous system and making cramps more likely. Beta blockers. These can affect peripheral circulation, making it harder for blood to reach the muscles. Parkinson's medications, antidepressants, and anticonvulsants. Some of these can affect the nervous system, leading to faulty signals being sent to muscles. Recognizing medication side effects. Cramps occur shortly after starting a new medication or changing the dosage. The cramps are unrelated to activity or diet. There are other symptoms, such as muscle pain, weakness, or unexplained fatigue. If you experience any of these signs, don't panic or stop your medication immediately. Doing so may cause more harm than good. Here's what you should do. Safe solutions if you suspect medications are causing cramps. Talk to your prescribing doctor immediately. They may adjust the dosage, switch medications, or add supplements to help mitigate side effects. Do not stop your medications on your own, especially for heart or blood pressure medications. Stopping suddenly could lead to a stroke or other serious complications. Monitor your body's reactions. Keep track of when the cramps occur, what medications you're taking, and for how long you've been using them. This will help your doctor assess the situation more accurately. Increase light physical activity and nutrition. Small adjustments like these can help strengthen muscles and improve their response to changes caused by medications. Regular testing. Some medications affect liver or kidney function or alter electrolyte levels. Regular blood tests can help detect issues early and allow for timely adjustments. Advice from personal experience. Throughout my years of practice, I've noticed that older adults tend to suffer in silence. They rarely consider that a small pill could have such a significant impact on their sleep and quality of life. Don't hesitate to ask your doctor. Don't hold back from sharing seemingly trivial issues like a cramp in the middle of the night. Sometimes, these small details can provide big solutions for your health. 6. Aging and muscle decline. If you think that your body is simply aging normally, I want you to know this. There is a huge difference between natural aging and aging that leads to loss of mobility. One of the clearest signs of this process is the increasing frequency of leg cramps as you enter your 60s and beyond. Cramps are not just a random occurrence. They signal that muscle groups are weakening, muscle mass is gradually diminishing, and the neuromuscular system is no longer functioning in sync as it once did. This is the inevitable consequence of sarcopenia, a medical term for the age-related decline in muscle mass. What's happening in your body? Starting in your 30s, your body gradually loses muscle mass, but this process is silent and accelerates significantly after the age of 60. It is estimated that every year, you can lose 1 to 3% of muscle mass if you don't stay active or maintain proper nutrition. When muscles weaken, muscle fibers lose elasticity and the ability to contract and stretch effectively. The nervous system controlling the muscles becomes less accurate. Blood circulation to the muscle groups decreases, slowing down recovery. The body reacts more sluggishly to impulses, making it easier for muscles to cramp uncontrollably. The consequences? You are not only more prone to cramps, but also at greater risk of losing balance, falling, osteoporosis, and losing the ability to care for yourself in the future. Signs you are experiencing muscle decline. Feeling fatigued after walking short distances. A sense of weakness in the limbs. Difficulty lifting heavy objects. Gradual weight loss without an apparent cause. Frequent muscle soreness, cramps, or mild trembling. Losing balance. Needing to hold on to something while climbing stairs or standing up. If you notice any of these signs, understand that your body is crying out for help. The good news is, you can still reverse part of this process if you take action early. Factors contributing to muscle loss in older adults. Lack of protein in the diet. Inactivity or prolonged sitting. No resistance training, muscle strengthening exercises. Lack of growth hormones or testosterone in men. Chronic diseases such as diabetes, heart disease, kidney disease. Prolonged use of corticosteroids or certain medications that cause muscle degeneration. Practical and effective solutions to slow muscle decline. Increase protein in your diet. Older adults should aim for 1.2, 1.5 g of protein per kilogram of body weight each day. Focus on lean meats, fish, eggs, dairy, tofu, and seeds. Engage in light resistance training. Weightlifting, stationary cycling, yoga, light squats, and leg raises. Aim to exercise at least 3 times a week for consistent results. Walk 30 minutes every day. This helps improve blood circulation and stimulates large muscle groups. Supplement with vitamin D, magnesium, and zinc. These help maintain proper muscle, bone, and nervous system function. Maintain a stable weight. Avoid abdominal obesity and visceral fat that strain the joints. Regular health checkups. Monitor muscle mass, bone density, and endocrine function for appropriate solutions. Mentality is the key to preserving muscles. One thing I always emphasize to my patients: strength doesn't just come from muscles, it comes from the will to act. You could be 70, 75, or even 80, but if you choose to stand up, choose to exercise, choose to eat healthily, your body will respond. Muscles can still recover, not necessarily to their former state, but enough to give you an active, independent life with fewer health issues. 7. Neurological issues and peripheral nerve damage. When it comes to leg cramps in older adults, many people often think about calcium deficiency or dehydration. However, there is another silent, more dangerous cause that is often overlooked: neurological disorders, particularly those affecting the peripheral nerves. I once treated a 66-year-old man who had no nutritional deficiencies, drank enough water, and exercised appropriately. However, every night he suffered from leg cramps, not just once, but 2 to 3 times a day. After conducting in-depth tests, the results revealed that he had peripheral neuropathy caused by diabetes, and this was the real cause of his uncontrollable cramps. So, how do nerves relate to cramps? The human body is a remarkable system, with the nervous system acting as the control center and muscles as the executing parts. Whenever you want to move, even if it's just your toes, the brain sends an electrical signal through nerves to the muscle. However, if the nervous system is damaged, that signal can be delayed, disrupted, or sent incorrectly. As a result, muscles contract at the wrong time. The cramps last longer than usual. Muscles are difficult to relax after contraction, causing prolonged pain and stiffness. This is exactly what happens when you have peripheral neuropathy. Common causes of peripheral nerve damage in older adults. Chronic type 2 diabetes. This is the leading cause of peripheral neuropathy, as high blood sugar damages small nerve fibers. Spinal degeneration, herniated discs. Nerves compressed over time lose their function. Vitamin B1, B6, B12 deficiencies. These B vitamins are essential for nerve health. Chronic alcohol consumption directly damages the nerve fiber membranes. Chemicals or drug side effects. Some cancer treatments and strong antibiotics can damage peripheral nerves. Autoimmune diseases such as lupus, polyneuropathy. Signs you might have nerve issues causing cramps. Cramps often come with numbness, a burning sensation, or a tingling feeling like ants crawling. Pain radiates from the back to the legs, or from the buttocks to the feet. Weakness in the hands or legs, slower movements. Abnormal temperature sensations, coldness or burning in the hands and feet. Cramps occur even when resting, not due to exertion or dehydration. If you notice these signs, be cautious and get your neurological function checked. Early detection can help you avoid serious complications like partial paralysis, loss of sensation, or a higher risk of falling. Treatment solutions and improving nerve function. Control underlying conditions such as diabetes, hypertension, to prevent further nerve damage. Supplement with B vitamins, especially B1, B6, B12, as prescribed. Engage in light physical therapy to maintain nerve-to-muscle transmission. Limit alcohol and substances that harm nerves. Acupuncture and therapeutic massage. Some traditional methods may help improve nerve circulation. Regular monitoring using electromyography or nerve conduction velocity tests to assess progress. Real-life experience. One of my female patients, 72 years old, had been suffering from muscle cramps and insomnia for nearly 2 years, believing it was just a part of getting older. After testing, we discovered she had a B12 deficiency and signs of nerve inflammation due to long-term anemia. Just 3 months after following a B12-rich diet and taking supplements, her symptoms nearly disappeared. She started sleeping better, walking more confidently, and her mental state improved significantly. This shows that sometimes, by simply listening to your body, you can identify the underlying cause and resolve recurring cramps for good. If you followed along this far, I believe you no longer consider leg cramps to be just a normal part of aging. They are warning signals, sometimes subtle, sometimes painfully disruptive enough to keep you awake at night, but they all deserve to be taken seriously. We have covered 7 common causes of leg cramps in older adults, from dehydration, vitamin deficiencies, muscle decline, to neurological conditions. The important takeaway is, this condition can absolutely be controlled and improved if you take action in a timely manner. Don't ignore minor signs like numbness, leg fatigue, or cramps in the middle of the night. Invest in your health by maintaining a balanced diet, staying active, and getting regular health checkups. If you are on prescription medication and notice any unusual reactions, consult your doctor. Don't silently endure the discomfort. You deserve to enjoy a healthy, active, and pain-free old age. Stethoscope, if you found this video helpful, please hit the like button, subscribe to the Senior Vitality Now channel, and share the video with friends or family members experiencing similar issues. This is the simplest way to spread accurate and humane health knowledge. And don't forget, we release new videos every week with in-depth healthcare content for those over 60, covering topics from nutrition, exercise, vitamins, to sleep, mental health, and chronic disease prevention. Thank you for staying with us until the end of the video. Wishing you good health, lots of smiles, and restful nights of sleep.